It is 2 in the morning. Your dog has been pacing for the last 20 minutes and they completely ignored their dinner earlier tonight. Or maybe your cat is sitting hunched in the corner of the bathroom, not moving, just staring at the wall with that look that makes your stomach drop immediately. The panic sets in fast. Is this serious? Do I wait until morning or do I put them in the car right now? And if you have ever been in that situation before, you already know what happens when you choose the emergency clinic. You walk through those doors, they take one look at your pet, and before a veterinarian has laid a single hand on your animal, you are already looking at a triage fee of $200 to $400 just for walking in. By the time they run some blood work and take a few x-rays, you are sitting in a waiting room holding an estimate for $2,000 or $3,000. You pay it because of course you pay it, because they are your family. And then the vet comes out an hour later, hands you back a perfectly fine pet, and tells you it was a minor stomach upset and to just monitor them at home. You are relieved. But you are also $3,000 poorer for something that could have waited until your regular vet opened in the morning. What if I told you that there is a $1 item available at any pharmacy that acts as a precise medical filter? One that tells you with real clinical accuracy exactly when a situation is a genuine emergency and when your pet is safe to stay home and sleep it off until morning? By the end of this video, you are going to have 4 specific veterinary-grade tools and techniques that will help you make smarter, calmer, more informed decisions in those late-night panic moments, save money on unnecessary emergency visits for minor issues, and know with confidence exactly when something genuinely does require immediate professional care. Hi everyone, I am Dr. Stephen Clarke and welcome back to the channel. Today, we are doing something a little different because this one covers both dog and cat parents, since a lot of you have both. We are going to talk about 4 practical home tools and techniques that every pet owner should know. I want to be very clear about something before we begin though, because this matters. Everything I am sharing today is designed to help you make better informed decisions about minor and moderate situations at home. It is absolutely not a substitute for veterinary care when something is clearly serious. If your pet is unresponsive, struggling to breathe, has visible major trauma, is having seizures, or your gut is telling you something is genuinely and urgently wrong, you do not stop to take a temperature or look anything up. You get in the car and you go. Trust that instinct. What we are building today is the knowledge base that helps you triage the ambiguous situations more calmly and intelligently, not a reason to delay care when care is genuinely needed. With that said, let's get into it. Chapter 1. The $1 emergency filter. When you bring a lethargic or unwell pet into an emergency clinic, do you know what the very first thing the triage nurse does is? Before they weigh your pet, before they look in their ears, before they do anything else, they take their temperature. Internal body temperature is one of the most immediately informative vital signs in veterinary medicine. A normal temperature tells you the body is not in active systemic crisis. An abnormal temperature in either direction tells you something significant is happening that needs attention. I want you to go to any pharmacy or grocery store and buy a basic digital thermometer, not a glass mercury thermometer, since those are genuinely dangerous if they break around an animal. Just a standard, fast-read digital one. They cost between $1 and $5, and they belong in every pet owner's home first aid kit permanently. Here is the medical baseline you need to know. Dogs and cats both run naturally warmer than humans. The normal healthy body temperature range for both dogs and cats is 100.5 to 102.5 degrees Fahrenheit, which is 38.1 to 39.2 degrees Celsius. This is their normal. It is not a fever. It is simply where their physiology sits. Now here is how the thermometer becomes your emergency filter. If your pet is lethargic, off their food, and acting unwell at 2 in the morning, take their temperature before you decide anything. If the thermometer reads anywhere within that 100.5 to 102.5 range, that is genuinely reassuring information. A normal temperature means the body is not in the middle of fighting a raging systemic infection or experiencing the kind of physiological crisis that warrants an emergency visit. It does not mean nothing is wrong, but it does mean the situation is very likely stable enough to be seen by your regular vet in the morning, rather than requiring a $3,000 emergency workup tonight. Note the temperature. Keep monitoring your pets, make sure they have access to water, and call your vet's office when it opens. On the other hand, there are 2 temperature readings that tell you to go immediately. If the temperature reads 104 degrees Fahrenheit or higher, your pet has a significant fever that indicates a serious systemic process, whether infection, inflammation, or heat stroke. And perhaps more urgently, if the temperature drops below 99 degrees Fahrenheit, that is a sign of serious physiological compromise, shock, or severe hypothermia, and it is actually more immediately dangerous than a high fever. Either of those readings, 104 or above, or 99 or below, means you go to the emergency clinic without hesitation. The thermometer just told you what you needed to know. Now let me walk you through how to take your pet's temperature at home safely and with minimal stress, because the technique matters. For dogs, keep a small tube of plain petroleum jelly, like Vaseline, next to your thermometer. Have your dog stand calmly, speak to them in a reassuring tone, and if helpful, have another person offer them a small treat or some gentle attention. Coat the tip of the thermometer generously with the petroleum jelly. Gently lift the base of the tail and smoothly insert the lubricated tip about 1 inch into the rectum. Hold it gently against the inner wall until you hear the beep, then remove it, wipe it with an alcohol wipe, and you have your reading. Most dogs tolerate this reasonably well, especially if you are calm and move slowly. For cats, the process is the same, but the cat's cooperation is often considerably less guaranteed. Here's a technique that makes this significantly easier. Take a large bath towel and lay it flat on a table. Place your cat in the center of the towel and wrap it snugly around their body, folding the sides over their back, leaving their head and rear end exposed, but keeping their legs and body firmly wrapped. This is sometimes called the burrito wrap, and it works because the firm, consistent pressure of the towel activates a calming response in many cats by limiting their ability to scratch and struggle. With a well-wrapped cat, one person can hold them gently while the other takes the temperature. Unwrap them immediately afterward, offer a treat, and let them go. Having practiced this once or twice before you actually need it in a crisis situation will make it considerably smoother when it matters. Chapter 2. The pilling technique that actually works. So you have made it through the night, your pet's temperature was normal, you went to your regular vet in the morning, everything is manageable, and now you are home with a bottle of antibiotics or another medication that your pet needs to take twice daily for the next 10 days. And anyone who has tried to give a dog or cat a pill knows that this is sometimes its own category of challenge. Dogs who seem cooperative until they realized what was happening. Cats who appear to swallow the pill and then deposit it neatly on the carpet 30 seconds later when your back is turned. Commercial pill pockets and soft treats work well for many dogs, but some dogs become expert at chewing the treat, tasting the medication inside, and spitting out just the pill. And for cats, even the pill pocket approach is often unsuccessful. Here is why pilling fails so often and what to do about it. When an animal is stressed, saliva production decreases significantly. A dry throat means that when a pill goes in, it sits against dry tissue rather than sliding smoothly through. This triggers the gag reflex, and the pill comes back out. We need to eliminate friction entirely. The solution is plain unsalted butter or plain cream cheese used as a coating. Take the pill and roll it in a small amount of cold butter or cream cheese until it is completely encased in a smooth layer of fat. The fat does 2 things simultaneously. It masks the bitter taste and smell of the medication, and it creates a frictionless surface that allows the pill to slide past the throat tissue without triggering the gag reflex. For dogs, hold the upper muzzle gently and tilt the head back until the nose points toward the ceiling. When a dog's head tilts back at this angle, the lower jaw naturally drops open without you needing to force it. Place the coated pill as far back on the center of the tongue as possible, then close the mouth, keep the nose slightly elevated, and stroke the throat gently downward. The combination of the lubrication and the head position means the swallow happens almost automatically. For cats, this same technique applies but requires more precision, since a cat's mouth is smaller and their resistance is typically higher. The same burrito wrap technique from the temperature section is enormously useful here. One person wraps and holds the cat, while the other administers the pill. The butter coating is especially important for cats because feline esophageal tissue is sensitive and a dry pill that gets partially stuck can cause irritation to the esophageal lining. The lubrication genuinely matters beyond just compliance. If your cat is completely impossible to pill, even with these techniques, here is an alternative that uses cat behavior rather than fighting against it. Crush the pill between 2 spoons into a fine powder, mix it with a small amount of butter or wet food gravy to form a sticky paste, and smear that paste directly onto the top of one of your cat's front paws. Cats have a deeply ingrained grooming reflex and genuinely cannot tolerate having something on their paws for more than a few seconds before they sit down and lick it clean. They will remove every bit of that medicated paste themselves completely voluntarily without you ever needing to open their mouth. This works reliably for most cats and is considerably less stressful for everyone involved. One important note: always check with your vet before crushing any medication, since some tablets and capsules are formulated in ways that require them to be swallowed whole to work properly or to release safely. Ask specifically whether the medication your pet has been prescribed can be crushed before using this technique. Chapter 3. The free bowl swap that clears up chronic facial infections. This one surprises almost every owner who hears it because it requires no medication, no vet visit, and no money beyond the cost of replacing something most people already need to replace. If your dog has recurring red bumps, crusty patches, or irritated skin around their lips and muzzle that keeps coming back despite treatments, or if your cat has recurring blackheads, scabs, or sore patches on their chin that your vet has called feline acne, the first question I would ask you is, what material is their food and water bowl made of? Plastic bowls are extraordinarily porous at a microscopic level. Every time a plastic bowl is washed with a sponge, put through a dishwasher, or simply used daily, tiny scratches accumulate on the surface that are invisible to the naked eye, but are significant at a bacterial scale. These microscopic grooves trap food particles, saliva, and moisture, and they are essentially impossible to fully sanitize with normal dishwashing because the bacteria are embedded inside the material itself, rather than just sitting on the surface. Over weeks and months, this creates a dense bacterial biofilm inside the plastic that your pet's face presses against at every single meal. In dogs, chronic contact with this biofilm can contribute to a condition called muzzle folliculitis or muzzle pyoderma, which causes exactly the kind of recurring red, crusty, bumpy irritation around the lips and chin that many owners spend months treating with topical antibiotics and steroids without ever addressing the source. In cats, plastic bowls are one of the most commonly identified contributing factors to feline acne, which presents as persistent blackheads, scabs, and sometimes painful infected sores on the chin. Switching from plastic to stainless steel or glazed ceramic bowls eliminates this ongoing source of bacterial contact because smooth stainless steel and properly glazed ceramic do not scratch and trap bacteria in the same way. Many owners who make this switch and begin washing the new bowls daily with hot soapy water report that their pets' chronic facial skin issues improve significantly within 2 to 4 weeks without any medication change. It is one of those interventions that costs almost nothing and has a surprisingly meaningful impact when the bowl is genuinely the underlying contributor. For cat owners specifically, there is an additional consideration when choosing a bowl. Cats have highly sensitive whiskers that are dense with nerve endings and serve as important sensory organs. When a cat eats from a deep, narrow bowl, their whiskers are repeatedly forced against the sides with every bite, which causes a form of sensory discomfort and overload that some cats find genuinely aversive. This is sometimes called whisker fatigue, and it can manifest as a cat that eats reluctantly, frequently removes food from the bowl to eat off the floor beside it, or abandons meals partway through despite being hungry. A wide, shallow bowl that allows the whiskers to extend freely without touching the sides eliminates this issue. For cats, wide and shallow stainless steel or ceramic is the ideal combination for both the skin and the whisker comfort reasons. Chapter 4. The Kitchen First Aid Duo. This final section is about 2 specific home first aid situations that send owners to emergency clinics regularly when they are, in most minor cases, entirely manageable at home with 2 inexpensive items that are almost certainly already in your kitchen. The first situation is a bleeding nail from cutting too short during a home grooming session. The blood vessels inside a dog or cat's nail, called the quick, run further toward the tip of the nail than many owners realize until the first time they clip too close and the nail immediately begins to bleed. Because the paws are well supplied with blood vessels, even a small nick of the quick bleeds noticeably, and the drops of blood on the floor or carpet often look alarming enough that owners head straight to an emergency clinic. In the vast majority of cases, a clipped quick is a minor injury that stops bleeding quickly with the right first aid and requires no veterinary attention whatsoever. The home remedy that works better than most commercial styptic powders is plain cornstarch. Cornstarch works by physically absorbing the liquid portion of the blood from the nail surface, rapidly concentrating the clotting factors and platelets at the wound site and accelerating clot formation. Take a pinch of dry cornstarch and press it firmly against the tip of the bleeding nail and hold steady pressure for about 10 seconds. In most cases, the bleeding slows dramatically within that time and stops within a minute or two. Reapply if needed. Cornstarch has no chemical stinging properties, which means it is significantly less distressing for your pet than commercial styptic powder, which contains silver nitrate and causes a noticeable burning sensation that many animals respond to strongly. Keep plain cornstarch in your pet first aid kit specifically for this purpose. The second situation is minor skin irritation or superficial scrapes. Whether your dog ran through rough brush and came back with an irritated patch of skin, or your cat has a minor surface scratch from an outdoor encounter, the instinct for many owners is to reach for a human antiseptic product from the medicine cabinet. I want to give you a clear safety warning here, particularly for cat owners. Human antibiotic ointments, such as Neosporin and similar triple antibiotic products, should never be applied to cats. Cats will instinctively lick anything applied to their skin, and one of the common antibiotic ingredients in human triple antibiotic ointments has been associated with serious adverse reactions in cats when ingested. Even a small amount licked from the skin can cause significant gastrointestinal distress, and in some cases, more serious reactions. Do not use human antibiotic ointment on cats under any circumstances. For both dogs and cats with minor skin irritation or superficial scrapes, a chamomile tea compress is a gentle, genuinely soothing, and completely safe alternative. Brew a cup of plain chamomile tea, allow it to cool fully in the refrigerator, and then either hold the cooled tea bag directly against the irritated area or soak a clean piece of gauze in the cooled tea and apply it as a compress for a couple of minutes. Chamomile contains compounds with mild anti-inflammatory and calming properties when applied topically, and because it is simply herbal tea, it is completely safe if your pet turns around and licks the area clean immediately afterward. It will not replace proper wound care for anything beyond a superficial scrape, and any wound that is deep, has broken skin with visible tissue underneath, shows signs of infection like swelling or discharge, or does not improve within a day or two should be seen by a vet. But for the minor contact irritations and surface scrapes that are a normal part of an active dog or cat's life, a chamomile compress is a useful, practical, and genuinely effective first response. Let me bring all four of these together into a simple home first aid kit checklist that you can assemble for almost no cost. One basic digital fast read thermometer from any pharmacy. One small tube of plain petroleum jelly to use as thermometer lubricant and pill coating. One pack of plain unsalted butter, or a small container of plain cream cheese in the fridge, specifically for pilling. Stainless steel or glazed ceramic food and water bowls for every pet in the household, washed daily with hot soapy water. A box of plain cornstarch in the kitchen cabinet, chamomile tea bags, the plain unflavored kind, a pack of clean medical gauze squares, alcohol wipes for cleaning the thermometer. That is the entire kit. It costs less than $20 to assemble if you do not already have most of these items, and it equips you to handle the most common minor pet health situations at home with confidence rather than panic. I want to close with something I think is genuinely important. Being a responsible pet owner does not mean going to the emergency vet for every frightening moment in the middle of the night, nor does it mean toughing everything out at home because you are worried about the cost. It means having enough knowledge to tell the difference between the two, calmly and clearly. The thermometer gives you objective data when your emotions are making it hard to think clearly. The pilling techniques give you a practical tool for following through on the treatment your vet prescribed. The bowl swap removes a chronic bacterial source that costs owners money in repeated treatments without ever addressing the root cause. And the first aid techniques give you the confidence to handle minor injuries without a $300 emergency triage fee for a bleeding nail. Knowledge is the thing that sits between panic and good decision making. You now have more of it than you did 20 minutes ago, and your pets are better off for it. If this video gave you practical tools you are going to actually use, please hit the like button. It helps this kind of genuinely useful content reach more pet owners who need it. Subscribe so you do not miss the next video, and leave me a comment below. Are you a dog parent, a cat parent, or do you have both? And which of these 4 hacks are you going straight to the pharmacy to sort out tonight? I read as many comments as I can, and I genuinely love hearing from you. Give your dog and your cat a gentle scratch from me, stay calm out there, and I will see you in the next one.